Hello and welcome to the Maintaining Health and Wellness class. In this presentation, I will share information with you that will be beneficial as you work with people we support and assist them with strategies to stay healthy. Additionally, I will cover skills you can use to observe, document, and report signs and symptoms of illness in people we support to ensure their health and wellness. The chapters covered in this module include the power of observation, which stresses the importance of observing for signs and symptoms of illness, body systems, which includes the respiratory and circulatory system, the genitourinary system, the muscular and skeletal systems, the gastrointestinal system, the nervous system, and the skin and sensory organs, reporting emergency and non-emergency health conditions and pain behaviors, and infection control. When we know the people we support well, we know about their usual demeanor in daily routines. We are able to observe when someone shows signs of physical and mental well-being. Health is a positive concept that emphasizes social and personal resources, as well as physical capacities. A combination of physical and mental well-being is necessary to achieve overall health. Physical health includes good bodily health, which is the result of regular exercise, a healthy diet, and proper rest. Mental health is a person's emotional and psychological well-being. It is the ability to function and meet the demands of everyday life, and the ability to handle normal levels of stress, maintain satisfying relationships, and lead an independent life and recover from difficult situations. Physical and mental health affect each other. Typically, if someone is physically healthy, they are also mentally healthy and vice versa. Health promotion includes activities and habits to improve health and to stay healthy. Components of health promotion include nutrition, strong social relationships, exercise, hygiene and infection control, stress management, healthcare, and public health policies and practices. We can assist people we support to learn about ways to stay healthy through health promotion strategies. Good nutrition consists of a healthy diet that includes a balance of vitamins, minerals, and nutrients that help protect against heart disease, bone loss, some cancers, and type 2 diabetes. Encouraging strong social relationships can contribute to good health conditions, a positive attitude, and long life. Exercise promotion helps to maintain physical fitness, a healthy weight, healthy bones, muscles, and joints, a strong immune system, and helps prevent diseases like cancer, heart disease, cardiovascular disease, type 2 diabetes, obesity, and back pain. Hygiene and infection control can be achieved through limiting contact with germs through activities like bathing, washing hands before eating, and proper cleaning of eating utensils and food preparation surfaces. Exercise, getting adequate sleep, eating healthy, and relaxation techniques can contribute to stress management. Managing healthcare by staying on top of yearly physicals and appointments and using healthcare provider services like walk-in clinics enhance overall health. And proactively seeking out health promotion services like regular vaccines address potential health issues before they arise. There may be times when the people we support are not able to use words to tell us how they are feeling. It is important that we use an observational mindset when we work with the people we support. An observational mindset allows us to tell if something is wrong with a person by observing changes in behavior, appearance, or sounds they make. It is important for us to use all of our senses when observing people we support for signs of illness. Visually, we use our eyes to observe a person and an affected part of their body or any behavior like facial expressions, grimacing, or holding a certain part of their body that might be an indication of pain. Auditorily, we use our ears to identify changes in sounds the person is making, like changes in breathing patterns, vowel sounds, and vocal sounds, and also the words they are telling us. We observe any changes in smell by using our nose to identify unusual or out of the ordinary odors. We use our sense of touch to confirm what our eyes, ears, and nose tell us. For instance, if someone's face appears red, we can use our sense of touch to feel their skin. If they are warm to the touch, they may have a fever, so we would want to check their temperature. When we know the people we support well, it's easier for us to pick up on cues that they may not be feeling well. It's important for us to document any changes from what we would normally see in a person we support. Does the person have a different look on their face than usual? Are they moving or sitting differently, or favoring a certain body part? Are there changes in the sounds they are making? Do they have a fever or change in temperature? Is their breathing different from usual? Is their skin a different color? Have they had any changes in their life or routine, like a new medication or loss of a loved one? Is the person eating and drinking? Are there changes in their bowel or bladder habits? Are they unwilling to participate in activities that they normally would? If you see a change, when did you notice it? The following video discusses ways we can observe signs and symptoms of illness.
Hi, my name is Sandy Germain and I'm the Coordinator of Nursing at Services for the Underserved. Today, we will be discussing signs and symptoms of illness. The goal of this training is to ensure that staff is adequately reporting the signs and symptoms of illness to the nurses. There are 3 ways to identify signs and symptoms of illness. One of the signs is through visual. This can present itself as injury, bruise, abrasion, bumps, and even rash. It's something that the staff can see. Those types of signs and symptoms of illness are very noticeable. The second way that a staff can identify something is wrong with an individual is through bodily functions. Not all the time that you can have an injury on the body. Sometimes signs and symptoms of illness presents itself through bodily functions, such as a discolored urine. If a urine is noted to be very dark, it may be an indication that there is an infection. It may be an indication that the individual is dehydrated. If an individual is noted with diarrhea or even constipation, that may be a bigger sign that something is going on. It's important that we're looking at the bowel movement charts to monitor these patterns. It's important that we're notifying the nurse immediately if these things are seen. Other bodily functions that we sometimes overlook may be foul odor with flatulence. Flatulence that smells like a strong egg odor, or even the mouth of an individual smelling very strong. This may be an indication of a serious infection called H. pylori that is very common that a lot of people can easily get. Another type of bodily function that could present as a possible illness is vomiting. Individual vomiting might be a clear identification that something is going on. Examples include food content. May be that the individual is constipated. That's why it's very important to report vomiting. The third way to identify signs and symptoms of illness may include the absence of signs and symptoms of illness, such as the baseline for the individual has changed. If you have an individual that's typically very active, moving around all the time, and then today or for the last couple days, they appear to be down, not moving, not eating, this may be an indication that something is wrong. Key points to remember in identifying signs and symptoms of illness include: first, get to know the individual's baseline in order to recognize when something has changed. Signs and symptoms of something small may be an indication of something bigger, so always report it to the nurse. Thank you.
Observation and documentation are very important and are the responsibility of the DSPs. DSPs are responsible for monitoring an individual's health on a daily basis and reporting any changes they observe in a person's health. DSPs are not responsible for determining when doctor appointments should be made or for diagnosing an illness. If a DSP has questions regarding the health of a person we support, they should contact their supervisor or the agency nurse. When observing and documenting, it is crucial for DSPs to use descriptive language. Descriptive language is precise and leaves little room for interpretation. It is a report of what the DSP directly observes and should not include any inferences or judgments on the part of the DSP. The examples below show the difference between sentences that are vague, general, and subjective, and sentences that are precise, detailed, and objective. Look at the first sentence on the left. Dan doesn't look right. This sentence states what the speaker thinks or infers about Dan. It is subjective and not the type of language that accurately describes a situation. The first statement on the right, Dan's cheeks are usually pink and he is always smiling. Today, his skin is very pale and he hasn't smiled all morning, even when Tom, his favorite staff, said good morning. This statement is objective, precise, and detailed. It accurately describes what the speaker saw happen rather than what they think happened. What about the second sentence on the left? Teresa isn't herself today. Again, this sentence is subjective and states what the speaker thinks is happening. The second statement on the right, Teresa usually eats cereal and toast for breakfast. This morning, she only ate a spoonful of cereal and then went back to bed. Tom said she ate a big supper last night. The speaker is stating exactly what they saw happen. With observation and documentation, DSPs should use descriptive language that depicts what they saw, like the sentences on the right. DSPs and other staff may play a role in assisting people we support with health appointments. Whether it's coordinating transportation or accompanying the person to the appointment, it's important that we support the person to play as active a role as possible in the process. Strategies we can use to help people keep and follow through with their appointments include asking the person the time of day they would like their appointment, allowing the person to choose their healthcare provider and who accompanies them to the appointment, and assisting the person to keep track of when the appointment is by using calendars, day planners, and placing notes around the house and other places where the person would see them. Additionally, we can help the person put together a list of questions they would like to ask at the appointment and share with the person what to expect at the appointment. If the person has anxiety in new environments, bring them to the appointment site ahead of time. Also, help the person to bring something to pass the time in the event that they will have a long wait. Some people we support may use adaptive equipment to assist them with everyday activities. They may also take part in various therapies. The goals of adaptive equipment and therapies include improving the person's motor ability and functional skills, to foster optimum appearance and integration of motor functions, to prevent or correct conditions that affect the person's current or future well-being, to support intellectual and emotional development, to support opportunities for inclusion and participation, and to support the individual to cope with the effects of their disability. Staff can support people in these areas by using various strategies. Staff can also assist people with carrying out therapies and using adaptive equipment as defined by their plans. Staff can document therapies and the use of adaptive equipment as prescribed and also observe for changes and report them to their supervisor or appropriate staff. If staff encounter barriers with any of these, they should request training on how to assist with adaptive equipment or carrying out therapies and reach out to their supervisor for assistance. Illness is the opposite of health, and just like health, can affect both the body and the mind. Signs and symptoms of illness can affect one or more of the body systems. DSPs are responsible for observing and documenting all symptoms that affect body systems. We will review the body systems and symptoms associated with them. The body systems include the respiratory and circulatory systems, the genitourinary system, the muscular and skeletal systems, the gastrointestinal system, the nervous system, and the skin and sensory organs. The organs that make up the respiratory and circulatory systems transfer nutrients and oxygen to cells throughout the body. Chronic conditions that affect the respiratory and circulatory systems include cardiac disease, asthma, allergies, and aspiration. Symptoms of the respiratory and circulatory systems appear below, along with changes to monitor with each symptom. Changes in a person's breathing pattern, the type of breathing, is it quick, slow, shallow, or labored, difficulty breathing, unusual wheezing or gurgling sounds, or an unusual odor to the breath should be documented. Changes with runny nose and nasal congestion should also be documented. Changes include sneezing, nasal discharge. It's important to make note of the color, fever, and difficulty breathing. If the person is coughing, it's important to make note of the type of cough. Is the cough productive or non-productive? Is the person coughing up discharge? If so, make note of the color and whether or not there is blood. Is the cough dry? Is the person hacking? Do they have difficulty breathing? With a sore throat, the severity of the pain, the sound of the voice, is it muffled or different? Whether or not the person can eat or drink, and if there is a fever, should be documented. Is the person showing allergic reactions like hives, a rash, itchy skin, difficulty breathing, tightness of the chest or throat, or dizziness or confusion? Allergic reactions should be documented, and it is helpful to know what the person is allergic to. Common allergens are bug bites, food, latex, medications, and pollen. Does the person have chest pain? Chest pain should be closely monitored and documented, especially for heart attack symptoms, which I will discuss on the next slide. Are there signs of edema? Edema is swelling caused by excess fluid trapped in body tissue. Areas affected by edema include the hands, arms, feet, ankles, and legs. Typically, the swollen area will remain indented when pressed. The area is red, warm, inflamed, and fever may be present. Heart attack symptoms can be sudden and intense or may start slowly with mild pain or discomfort. With milder symptoms, it is common for people to wait too long to seek out medical help because they do not feel the symptoms are serious. Medical attention is needed immediately if the person has had chest pain that does not go away, crushing pain or pressure in the chest, or chest pain accompanied by nausea, sweating, dizziness, or shortness of breath. Additional heart attack symptoms include persistent chest pain or pressure that lasts longer than 3 to 5 minutes or goes away and comes back, persistent chest pain spreading to the shoulders, neck, jaw, back, or arms, shortness of breath or trouble breathing, nausea or vomiting, dizziness, lightheadedness, or fainting, pale, ashen, or bluish skin, and sweating. Stroke symptoms occur when someone has a stroke, which is a type of cardiovascular disease that affects the arteries leading to and within the brain. If symptoms are detected early, treatment can decrease the chances of brain damage and death. A technique to remember stroke symptoms is using the acronym FAST. F refers to the face. If the person has weakness on one side of their face, it could be a stroke symptom. Ask the person to smile. If they can only smile on one side of the face, or you observe drooping on one side of the face, they are showing signs of a stroke. A refers to the arm. If the person has weakness or numbness in one arm, it could be a stroke. Ask the person to raise their arms. If they are only able to raise one arm, or if they show weakness in one arm, they are showing signs of a stroke. S refers to speech. If the person has difficulty speaking or slurred speech, they are showing signs of a stroke. T refers to time. If you see any of these 3 main stroke symptoms, it is time to call 911. The brain, spinal cord, and nerves make up the nervous system, which regulates all other body systems. Seizures are a condition of the nervous system, and many people with disabilities have seizure disorders. Seizures can affect the whole body or only specific parts. With people who have been diagnosed with epilepsy or seizure activity, seizures are typically not an emergency. However, if a person you support has a seizure and you have no indication that seizure activity is common for them, you should seek immediate medical attention for that person. If you are with a person when they have a seizure, the most important steps you can take are to ensure the person does not get injured while having a seizure. It is the responsibility of staff to thoroughly observe and document the seizure, including observation of what the person was doing prior to, during, and after the seizure, and the behaviors and body parts that were involved. Staff should stay with a person who has had a seizure until they have gained full awareness and are comfortable resuming regular activities. Staff may need to inform the person that they had a seizure. In addition to seizure activity, there are other components associated with the nervous system that should be monitored. These include signs of delirium, which is a state of confusion with agitation and hallucinations, dizziness, which can include unsteadiness, confusion, spinning feelings, nausea, and vomiting, fainting, which can be preceded by dizziness and can include nausea and paleness. It is important to document the length of time a person was unconscious if they do faint. A headache with neck stiffness might include pain behind the eyes or coming from the neck. Be sure to document the duration of the headache. Head injuries, which might be a concussion, so it's important to document and monitor dilated pupils, vomiting, confusion, drowsiness, headache, and bleeding from the nose or ears, insomnia, which might include restlessness at night, changes in the level of consciousness, which might include unawareness of surroundings, the inability to move or speak, and vision problems, any type of full or partial paralysis, and any body tremors. The mouth, stomach, intestinal tract, pancreas, and liver make up the gastrointestinal system. They break down food so it can be used by the body and rid the body of solid waste. Changes to monitor include appetite, like a decrease or increase in appetite, and any problems chewing or swallowing. A change in weight of 5 pounds or more within a month must be reported and documented. With the mouth and teeth, any odor to the breath, bleeding gums, or sensitivity to hot or cold should be documented. Any signs of heartburn or gas, like pain in the upper stomach behind the breastbone, unintentional weight loss, acid-like taste in the mouth, and belching should be documented. Nausea and vomiting should be monitored, along with any aversion to food, amount and frequency of vomiting, and signs of dehydration. Vomiting is typically not serious, but can be considered serious if symptoms continue for days, if the person cannot keep food down, if there is forceful vomiting, if there is blood detected, and if there is chest pain. Additionally, any abdominal discomfort should be monitored, including pain, a bulging of the abdomen, and if any areas are hard to the touch. The color, odor, and frequency of stools should be monitored, especially stool elimination, which can vary greatly from person to person. One person might have twice daily stool elimination, whereas another person might have every other day stool elimination. Constipation should be monitored, and any difficulty going to the bathroom, absence of stools, and abdominal or rectal pain. Diarrhea should be monitored, and the difference between diarrhea and loose stools should be noted. Diarrhea has a sense of urgency and occurs 3 or more times per day, where loose stools do not. Any pain, increase in frequency, stomach cramps, blood, and abdominal color should also be monitored with diarrhea. Did the person just start a new medication? As with vomiting, signs of dehydration, which include dry, wrinkled, or loose skin, a dry, parched tongue, absence of urination, or dark urine should be monitored. Hemorrhoids, which are distended veins in the rectum caused by constipation or straining, should be monitored. Specifically, any pain, discomfort, bleeding, swelling, or distended veins around the anus. If something poisonous or non-edible has been eaten, poison control or 911 should be contacted. The genitourinary system consists of two components: the urinary component, which is made up of the kidneys, ureters, bladder, and urethra, and the genital component, which is made up of the male and female sex organs. The urinary component regulates the balance of liquids between what a person takes in and what they eliminate. On a side note, the average adult has a daily intake and output of fluids equal to 3.5 quarts. The genital component is responsible for reproduction. With the genitourinary system, it is very important to monitor for signs of a urinary tract infection. Symptoms of a UTI include urine with a strong, foul odor, frequent urination, burning during urination, increased frequency of incontinence, and an additional symptom of confusion in the elderly. Other things to monitor with the genitourinary system include the color, odor, and amount of urine, any changes in urination frequency, pain or burning during urination, and incontinence. Any unusual discharge along with color, consistency, amount, and odor should be monitored. Any genital itching or changes in the sexual organs like lesions, rashes, lumps, bumps, swelling, or discharge should be monitored. Also, any signs of dehydration like dry, wrinkled, loose skin with a dry tongue and mouth, a decrease in urination, dark urine, and sunken eyes should also be monitored. Again, signs of dehydration should also be monitored and reported with diarrhea and vomiting. The muscles, cartilage, tendons, bones, and connective tissue make up the muscular and skeletal systems, and they provide support and protection to the body, along with mobility. Things to monitor should be any changes in the person's gait, like an inability to walk, unsteadiness while walking, staggering, stumbling, and limping. Any changes to muscle tone, like shrinkage and muscle tone that is soft, flabby, relaxed, stiff, or tense, should be monitored. If someone has suffered from a sprain, strain, or broken bone, it should be treated as if it's a fracture until correct diagnosis has been made by a medical provider. Other things to monitor are pain and tenderness at the site of the bone, swelling, bluish discoloration, bruising, the inability to move the body part, and unnatural shape, movement, or positioning of the body part. Additionally, any pain, tenderness, or aching at a joint should be monitored, along with any restriction of range of motion and difficulty moving. Although it's not officially a body system, the skin is the largest organ of the body, and it provides protective covering for the other body systems and also filters disease-causing elements in the environment. As with all other systems, the faster a symptom becomes a problem, the more urgent the problem. Wounds like cuts, scrapes, scratches, and punctures should be monitored. Puncture wounds usually close, but they have a high risk of infection. Things to monitor are location of the wound, the type of wound, how it occurred, the size, and any bleeding. Wounds should also be monitored for infection, since people with other health issues, the elderly, people with disabilities, people with limited mobility, and people who have been recently hospitalized are more likely to get a wound infection. Things to monitor include pain and swelling around the wound, if the area is red or warm to the touch, tenderness, pus, a fever, and a red streak that travels up an extremity toward the heart, which should be reported right away. If someone receives a bite from a person or animal, it may be in the form of a scratch, skin tear, puncture, or damage to tendons. Signs of infection and any loss of feeling should be reported right away. If the bite was from an animal, its immunization status should be obtained. Burns are divided into 3 categories. First-degree burns are red and painful, second-degree burns cause the skin to blister, and third-degree burns cause charring and crusting of the skin and are very serious. It's important to monitor and document burns and pay attention to common ways people we support might get burned. People with disabilities have an increased risk for injury from burns for various reasons. Some medications increase sensitivity to the sun, and some people may not be able to sense pain or temperature due to poor circulation. If someone has chills, which is when the muscles rapidly contract and relax to generate heat, symptoms should be monitored. Look for change in skin color and whether or not the person has a fever. Fever is a normal reaction to infection or inflammation and is usually not harmful, but should be reported. Frostbite is damage to the skin and underlying tissues caused by extreme cold. Symptoms include redness, warmth, tenderness, swelling, and itchiness of the exposed area. The skin may also appear white, firm, waxy, and have blisters or numb areas. All frostbite symptoms should be reported right away. Extreme heat can cause serious symptoms for people we support and might be considered an emergency if the person suffers from heat cramps, heat exhaustion, or heat stroke. Heat stroke can be life-threatening. Symptoms to monitor include muscle spasms of the legs or abdomen, skin that appears cool, moist, pale, ashen, or flushed. The person has nausea, vomiting, dizziness, weakness, exhaustion, is sweating, has changes in their level of consciousness, or warm areas on the body. Insect bites and stings are usually not serious, and symptoms include itching, stinging, and swelling. If the person shows signs of a serious allergic reaction like fever, hives, painful and swollen joints, nausea, cramps, and vomiting, or life-threatening allergic reactions like difficulty breathing, swelling of the lips or throat, faintness, dizziness, and confusion, medical attention is needed right away. If the person has a rash, the physical characteristics should be monitored. If the person feels hot to the touch, they might have a fever. Neck stiffness and shortness of breath should be reported with a fever. It's common for people's skin to change as they age. Some changes can be considered serious and may be a new growth, which could be melanoma, a form of skin cancer. Things to monitor include the skin color, any new growths, changes in color or size of an existing mole or blemish, a red, scaly, or crusted growth, a sore that doesn't heal, and any areas of the skin that are sore, itching, or bleeding with discharge. We covered how we can use our senses to observe for signs of illness in people we support, and it's also important to observe for signs of illness in the sensory organs of the people we support. Vision and hearing greatly influence a person's ability to be involved in and benefit from daily activities. Many people we support have conditions that affect their vision and hearing. With the ears, people may experience tinnitus, which is a ringing in the ears. They may also experience Meniere's disease, which includes symptoms of tinnitus and dizziness. Other symptoms associated with ear issues include pain, pulling at the ears, hitting of the head near the ears, complaints of itchiness or the ear feeling full, redness, swelling, discharge, headache, tenderness behind the ear, hearing loss, and dizziness. Diabetes is the #1 cause of blindness in the United States. There are people we support who are diabetic, so any changes in vision like pain, inflammation, discharge, dilated pupils, a red, cloudy, pink, or glazed appearance, tears, dry eyes, swelling, straining to see, among other symptoms, should be reported. The nose filters, warms, and moistens the air we breathe to keep the lungs from drying out. A bleeding or runny nose and congestion should be monitored. Also, it's important to remember after age 50, the ability to smell and taste gradually begins to decrease, and we may notice this in people we support. With any symptoms, the faster a symptom appears, the more serious the situation. There are some situations that are considered life-threatening, and calling 911 is required if any of them occur with people we support. They include excessive and uncontrollable bleeding, breathing that is obstructed or has stopped, the heart stopping, deep burns, severe injury from an accident, uncontrollable behavior that is a danger to the individual or others, loss of consciousness that is not related to typical seizure activity or fainting, persistent pain in the abdomen, vomiting with blood, a head, neck, or back injury, symptoms of poisoning, a broken bone protruding from the skin, a sudden severe headache, and slurred speech. Most health situations involving people we support will not be considered life-threatening, but we always need to observe and document. It's important to pay attention to what you see and hear. Something that is different from typical behaviors for the person might indicate that something is wrong. People have unique pain thresholds. Some people we support may not feel pain the way we do. They may not feel pain as intensely as most people, or they may feel pain in a situation where most people would not experience pain. People communicate illness in different ways. It's important to get to know the people we support well so we can pick up on cues they are giving that might indicate they are not feeling well. Infection control is a significant component of avoiding illness. In order to engage in effective infection control, we need to understand the infectious process, which is a continuous circle and consists of 4 components. The infection itself is the invading organism, which can be a virus, bacteria, fungus, intestinal parasite, or other microorganism. The invading organism needs a host to live and multiply. There are 3 general types of hosts, which are humans, animals, and non-living things. So basically, anything can be a host. For example, a fungus can grow on a rock, which is not living. Once the invading organism has found a host to invade, it looks for a way to leave and find a new host in order for the infectious process to continue. Methods of escape in humans include the respiratory tract, intestinal tract, genitourinary tract, through blood and bodily fluids, and breaks in the skin. Finally, the organism finds a new, vulnerable host. In the case of humans, whether or not a person is susceptible to the invading organism depends on the amount of invading organism present at the time of exposure, the length of time the host is exposed to the organism, and the person's overall physical and emotional health. Infection control refers to the steps taken to protect people from infectious disease. The goals of infection control are to prevent illness and disease by stopping the infectious disease chain of events and to provide early detection, intervention, and referral. Infection control preventative methods include standard precautions, immunizations, and early detection, intervention, and referral. Protective barriers are standard precautions. They include gloves, which should be used when hand contamination is anticipated. Gloves are intended as single use and should only be used one time. Masks and eye protection should be used when splashes might occur. The most important technique of all of the infection control practices is hand washing. Hand sanitizers are only a supplement to hand washing. Hand sanitizers should only be used in place of hand washing when access to hand washing is not available. It's important to use the correct hand washing steps. The proper hand washing steps are turning on the faucet to warm water. If warm water is not available, the temperature is not as important as the friction used to wash hands. Wet hands with water. Apply liquid soap to hands. Rub hands together for 15 to 20 seconds to form a lather. Scrub nails by rubbing them against the palms of hands. Rinse hands with fresh water. And dry hands with single-use paper towels or an air dryer. Hand washing should be implemented in many situations at work. It should be done after using the toilet, after assisting with toileting, after assisting with incontinence protection, between assisting two different individuals, before and after preparing or eating, when cooking, before and after handling meat, after smoking or touching your face or hair, after removing gloves, when arriving for work, before leaving work, before and after medication administration, and immediately after contact with blood or bodily fluids. Remember, washing hands and wearing gloves are not substitutions for each other. They are only meant to complement one another. Standard precautions include avoiding accidental cuts and wounds and environmental controls. We can prevent accidental cuts and wounds by never recapping a needle and discarding needles or sharp medical objects immediately in an appropriate puncture-resistant container after its use. Environmental controls are essentially routine housekeeping procedures and include cleaning and disinfecting contaminated surfaces, contaminated food contact surfaces, and contaminated laundry. The proper steps for cleaning and disinfecting contaminated surfaces include wearing gloves, placing paper towels over the spill and wiping it up, placing the unused paper towels in a securely closed, leak-proof bag labeled with the type of contaminant, using a fresh bleach solution of 1/4 cup bleach to 1 gallon of water or hospital-grade disinfectant to vigorously clean, then rinse the contaminated area, and washing hands afterwards. One thing to note, the bleach and water solution must be made fresh. It should not be prepared beforehand to use at a later time. Proper steps for cleaning and disinfecting food contact surfaces include wearing gloves, placing paper towels over the spill and wiping it up, placing the unused paper towels in a securely closed, leak-proof bag labeled with the type of contaminant, using fresh water and detergent to vigorously clean, then rinse the area, soaking the area in a freshly prepared solution of 1/4 cup bleach to 1 gallon of water for at least 1 minute and allowing it to air dry, and washing hands afterwards. The proper steps for handling contaminated laundry include wearing gloves and a non-leak-through gown or outer garment if needed, handling the contaminated laundry as little as possible, being sure not to mix it with other laundry, soaking or washing blood-stained items in cold water in the washing machine for at least 10 minutes to avoid the stain from setting, washing the clothing for 20 minutes based on the care label in 140-degree temperature water, or using virucidal laundry detergent at a lower temperature or with bleach added to the water if allowed, and drying the laundry in the dryer according to care label instructions. If the item cannot be washed immediately, bag it at its place of origin in a leak-proof bag labeled with the person's name and type of contaminant. MRSA, sometimes referred to as the superbug, is a common bacterium that can be found on the skin, in the nose, and in moist body areas. It occurs mostly in people who undergo invasive medical procedures or who have weakened immune systems and are being treated in hospitals. The symptoms of MRSA include areas that are red, swollen, painful, warm to the touch, full of pus or drainage, and a fever. MRSA is typically treated with antibiotics. MRSA does respond to antibiotic treatment, but may return at a later time. If you are accidentally exposed to blood or other bodily fluids from another person, there are specific steps to follow. Accidental exposure can occur if blood or bodily fluids get into someone's eyes, nose, or mouth, or through a wound or break in the skin. If your eyes, nose, or mouth are exposed, immediately flush the exposed area with fresh water for 3 to 5 minutes. If you are exposed through a needle stick or skin break, immediately wash the affected area well with soap and water for 3 to 5 minutes. Then notify your primary physician, the agency nurse, and your supervisor, and follow any further instructions. Vaccines and immunizations are another method of infection control. Immunizations provide immunity or resistance to specific diseases. Common vaccines are diphtheria, pertussis, and tetanus, measles, mumps, and rubella, polio, and hepatitis B. Hepatitis B vaccines can be administered for pre-exposure if someone will be working or spending a time in a place where risk of infection is increased, or after someone has been exposed to the disease. DSPs are likely to be the staff members to first notice health problems with the people we support. It is the responsibility of DSPs to observe and report any potential health issues. Early detection of an illness can result in early intervention and thorough treatment. Thank you for joining the Maintaining Health and Wellness class. When you are ready, you can sign up for a time to take the test. If you have questions or need additional assistance, please email the training department at rrhsftraining@rrhsf.org. Thank you.